Hi everyone, Varun here and back with the videos again, right? So today my focus is going to be around health in relation to weight loss and weight neutral interventions. So often there's always this big focus towards losing weight and usually just seeing the scale drop, but this doesn't always have to be the only focus. As we've seen, forms of self-monitoring has been theorized to potentially create a negative perception around self-worth. It can include a pattern of perfectionistic, dichotomous, and obsessive thinking around weight, shape, food, and dieting. It's important to remember that the number on the scale does not dictate who you are as a person, and only focusing on the scale can make you generally lose sight of that process that leads to a healthier life. Yes, I can say that one of the most predictive things about health is your degree of adiposity and physical activity levels. And I'm not saying that we should ignore it, but I'm saying let's get you to a healthier outcome via a process-oriented approach. So if you were to focus on some weight neutral interventions, this would revolve around things such as improving your relationship with food, removing moral judgment around food, building awareness around your hunger and your fullness cues, emphasizing emotional and physical wellness over the pursuit of a lower weight or size, and advocating for the removal of the stigma experienced by persons with larger bodies. And I would refer to Dogma 2020. There was a meta-analysis which would have examined the effects of weight neutral compared to traditional weight loss approaches, and they would have examined things such as weight and BMI, lipid variables, blood pressure, glycemic variables, eating behavior, binge eating, self-esteem and depression, quality of life, diet quality, physical activity levels. The summary would have said that there was a non-significant trend for weight, focusing on weight loss approaches, and initially the review suggests that there's no strong evidence to support the use of one approach over the other for health. Now, except where there's a concern for eating behaviors, particular bulimia, in that case, a weight neutral approach could be indicated. It does advise about, caution when it comes to giving these weight neutral interventions. All right. So there's also another study by Bacon 2011, which I can refer to, and it would have mentioned that the pursuit of weight always isn't a positive goal. Now, it can cause things like eating disorders, anxiety, and there's rarely a dose-response relationship between weight loss and health benefits. So it's usually on a spectrum, which means that the more weight you lose doesn't actually mean that you're going to be healthier. All right, and it suggests that behavior change as opposed to weight loss itself plays a greater role in improvement around health, especially around things such like reduced blood pressure, blood lipids, and improvement in insulin sensitivity. And we should look at these interventions to be constructed where it gives consideration to physical, emotional, social, occupational, intellectual, spiritual, and the ecological aspects of health. And some of these interventions that I can give advice on, or it would have stated, you can aim to modify your behaviors, eat more fruits and vegetables, increase your protein intake, engage in physical activity and exercise, improve your relationship with food, and make changes to your environment, your food environment, that is, practice portion control, try to get better sleep, and not eat for emotion. So weight loss isn't the focus here, but it will be an outcome of these health-seeking behaviors, and it's gonna boil down to the energy balance equation. But at that point, it's already gonna be integrated into your lifestyle that you can upkeep and even dial in to be more specific to your goals if you need it. I've said it before, and these behaviors and lifestyle changes will carry forward to even allowing you to hit your goals, to even live a healthier life overall, and even maintain said weight loss for the long run. All right, so my aim here was just to maybe open up your mind to think differently. I know we continuously push the phrase caloric deficit for weight loss, and which is 100% true, and it is required, but it is also a weight focused statement, and sometimes we could push that and forget to promote the health seeking behaviors as well. All right, so I just wanted to change the conversation a bit, and maybe we can also start pushing these health seeking behaviors just as much, because it would have a positive impact on health and weight loss for those looking to change. All right, so thanks for watching, guys, and I will definitely try to post more let me know what you think and do share. Bye.